Dears, I am Dr. P.N. Suresh Kumar, Director of Chedana Center for Neuropsychiatry. I would like to briefly discuss about the deep transcranial magnetic stimulation machine which has just recently introduced in our hospital. So, the basic principle of transcranial magnetic stimulation treatment is an electrical current passing through a stimulating coil that will induce powerful magnetic field and that will produce intracranial electrical field and that will stimulate the neurons, thereby activating targeted neuronal pathways. This is based on Faraday's law, in which powerful magnetic field can produce intracranial electrical field based on electromagnetic induction. There is an unmet need in the treatment of various psychiatric treatments. The existing treatments such as pharmacotherapy, psychotherapy, electroconvulsive therapy are not sufficient to meet a sizable number of patients, and that will not give enough improvement for psychiatric patients. So RTMS and DTMS, these are both stimulating treatment of brain. But there are some differences between RTMS and deep TMS. The so-called conventional RTMS, that will just stimulate the superficial areas of the brain. That means it will just scratch the superficial areas of the brain. Whereas in deep TMS, we are using a special H type of coil. It is a unique patented coil that will penetrate deeper areas of the brain and that will target more broader areas of the brain, thereby activating more neuronal pathways and thereby giving maximum improvement for the patient's condition. This is a transcranial magnetic stimulation machine. This machine is manufactured by Brainsway and this is manufactured in Israel. In fact, this is only one of the few centers this machine is available in India. Now, I will give you the brief description about the parts of the machine. Here you can see a computer screen. In the screen, we can select the patient, we can enter patient's age and disease and all other details. This is basically a computer screen. Using this computer screen, we can do various things. We can assess the patient's motor threshold, and based on this motor threshold only, we'll give how much stimulation is needed for that particular illness. That will calculate by finding out the motor threshold. I will tell you about that later. So this is the machine. Actually, in fact, this is the heart of the machine. This is the CPU. It is just like the CPU of a computer. So there is a cooling system inside this system. This cooling system will actually cool all the magnetic coils that is deeply inserted in all these different helmets. This is H1 helmet. This helmet is used for the treatment of depression. Inside the helmet, you can see there is an H type of coil. It is situated which is very safely inserted into this helmet. So once the current is passed through this H type of stimulating coil, this will become a highly powerful magnet. And once it is placed over the head of the patient, this magnet will produce intracranial field, electrical field inside the head, inside the brain of the patient, and that will target the particular neurons and particular neuronal pathway that we are specifically aimed or targeted for the treatment of different psychiatric conditions. So this helmet, sometime there's a chance for getting this particular coil may be heated. So to prevent that heating of the coil, that's what this cooling system is needed. This cooling system will continuously cool the helmet, and at the same time this helmet is cushioned. So it will provide comfort to the patient also. Once it is put on the patient's head, this will give comfort to the patient. There's a cooling system is there, and this helmet system will provide mobility of the patient also. That is without compromising the efficacy of the treatment. Now we will demonstrate how we are delivering deep transcranial magnetic stimulation in a depressed patient. So we have a depressed patient here. He is sitting comfortably in this chair. Now we will start the procedure. First, he has to put two earplugs into this ear because this machine will produce some uncomfortable noise. So in order to prevent this noise coming to this ear, we can put tight two cotton plugs in both ears. Now we will put one surgical mask on the head. This is for hygienic purpose because the mask, actual mask we are using, that we cannot put on every head because that should be very hygiene. So to keep hygienity, we have to put a different mask. This is a disposable mask. Over this mask, we will put the actual transcranial stimulation calculation mask. This is just like EEG mapping. There is a red line here. Here to tighten this mask. This line should be exactly on the middle of the forehead. Now this is the calibrating. See, there is a red line here. That line should come exactly into the middle of the nose, and there are different digits are mentioned here, 7, 8, 9, like that. So the helmet should come exactly on the stipulated this particular number. And you can keep the helmet here. Yes, there is a red line here. It is mentioned on the helmet. Now this red line should exactly come on the red line that is shown in this map. So by this way, we can calculate the motor threshold. That means by which we have to calculate, we have to find out the area, the target area at which we have to give the deep brainwave stimulation. So everything is okay. We have entered all the patient's details here. In this screen, you can see the number of frequency required and number of pulses required, total time that this stimulation should be given. Everything is calibrated and it is mentioned in this monitor. Now everything is clear. The helmet is in the safe secured position. Okay, now the helmet is safely kept on the patient's head. Now all the threshold parameters are rightly kept. It is there in the monitor. Now we can start the machine and the machine will do everything. The time the machine will automatically calculate. The threshold, pulses, everything will automatically, the machine will tell us. Now the patient is very comfortable. We can start the machine. Now he can comfortably sit here and this machine will deliver whatever the protocol, required protocol, whatever is needed for this depression protocol, that the machine will automatically deliver. After 20 or 30 minutes, the machine will automatically stop giving the magnetic pulses. Then he can comfortably, he can come out from this. We will remove everything and then he can go home. Deep TMS is purely an outpatient treatment. Compared to many invasive treatments such as electroconvulsive therapy, here there is no need for anesthesia, no need for injection, there is no any prolonged recovery period, and moreover, this can be incorporated into their daily routine life. They can come alone, they can come to the hospital by driving their vehicle, and very well they can go back by driving their vehicle. And moreover, this can be incorporated to their existing treatment regimen so that their treatment efficacy can be boosted. DTMS can be used in the treatment of depression, obsessive-compulsive disorder, bipolar disorder, negative symptoms of schizophrenia, post-traumatic stress disorder, obesity, and autism. In various neurological conditions, DTMS can be used for the treatment of Alzheimer's disease, Parkinson's disease, post-stroke rehabilitation, migraine, tinnitus, and multiple sclerosis. Now, there are a subset of patients, treatment-resistant patients, who can benefit from deep TMS. In fact, in real clinical setting, a study relying the data on 1,000 patients who are taking treatment for depression, it was found that at least 75% of the patients had very good positive response, and 1 in 2 of these patients had clinically powerful remission with the deep TMS treatment. In depressive disorder, deep TMS is the approved TMS system treatment which will penetrate deeper areas of the brain, broader areas of brain, and thereby effectively alleviate the symptoms of depression. In depression, we are using H1 coil in the treatment, and this H1 coil targets the neuronal areas mainly related to reward, pleasure, motivation, etc. That is mainly the dorsolateral prefrontal cortex. Many randomized control trials, multi-center studies, sham control studies, they have shown proven efficacy in the treatment of depression with the deep TMS treatment. In real clinical practice also, many treatment-resistant patients have achieved remission with the deep TMS with a superior efficacy in the treatment. Here, there are two types of treatment. We have a regular treatment, that means every day with 20 to 30 minutes we can give session for the treatment of depression. That is regular session. But in the treatment of depression, there will be at least 25 to 30 sessions are needed per day. So to cut off the number of sessions and duration of the treatment, there is another type of treatment, that is intermittent theta burst stimulation. It is known as ITBS session. This ITBS session will last only for 3 minutes. So we can give 3 minute session, then 1 hour interval, then again another ITBS session. Like that we can give 5 to 6 sessions per day, so that within 6 to 7 sessions, within 6 to 7 days of treatment, we can complete the total number of sessions. So this is a very good modality of treatment in the treatment of treatment resistant depression as well as the depression itself. In obsessive compulsive disorder, DTMS has proven its efficacy in the symptom control, especially many randomized, multi-center, and sham control studies, and extensive post-marketing data has proven its efficacy in obsessive compulsive disorder. Here we are using H7 type of coil, and that will target the neuronal pathways that will mainly aimed at the neuronal pathways that will lead to inhibition of impulsive behavior. That is mainly corticostriatothalamic circuit, mainly the anterior cingulate cortex and the medial prefrontal cortex. In clinical practice, DTMS has shown its proven efficacy in the treatment of in the symptom control of obsessive compulsive disorder. Here also we can have regular sessions like 20 to 30 minute session per day, but the problem is that this regular session, at least 30 to 36 sessions are needed for the treatment of OCD. So there is another type of session. This is known as ITBS, intermittent theta burst simulation type of session. In this protocol, we are using a 3 minutes ITBS session followed by 1 hour rest or 1 hour interval. Like that, we can give 5 to 6 sessions, ITBS session per day. So that within this ITBS session, we can cut short the number of days which is required for the treatment of obsessive compulsive disorder. It is actually a promising solution for the cessation of smoking and for various other substance abuse disorders like alcohol, cocaine, and various other substance abuse and behavioral addiction also. Here we are mainly targeting the lateral prefrontal cortex and the deeper layers of insula. It's a promising treatment, upcoming treatment for the treatment of various addiction disorders. Now, another area, another indication for deep TMS is post-stroke rehabilitation. In post-stroke rehabilitation, the conventional treatments are mainly focusing on motor plasticity. That means the plasticity we are targeting by using mechanical devices, robotic and electrical devices. But in deep TMS, we are mainly focusing on the neuronal plasticity, the plasticity in the brain, by which we are penetrating deeper areas of the brain and more broader areas of the brain, and thereby we are stimulating the neurons which are lying within the damaged or underactive brain areas. So many studies, including sham control studies, that have proven its efficacy in the motor upper and lower limb dysfunction. Deep TMS is offering its flexibility of use and its comfort. Patient can either sit in a chair, they can sit in a wheelchair, or they can sit in a stationary bike. Either they can be active or they can be stationary. It can be added to the existing treatment regimens. So this is about, in short, about the DTMS procedure in post-stroke rehabilitation.